Having a concern about the potential of documentation review or chart review should motivate us to learn the rules and to follow the rules. Having that concern, having a healthy awareness of the fact that a third-party payer may conduct a chart review, being aware that an audit may occur, should, I suggest, never stop us from providing the care that we are trained to provide, should never limit the care that we provide, and should never scare us out of providing the care to our patients that they need, should never stop us from having a successful, thriving practice. And instead, that awareness of the potential for documentation review, being concerned about the potential of an audit or chart review, should only motivate us to learn the rules and to follow the rules. And in this discussion, we are going to talk about the documentation requirements associated with our provision of surgical dressings, including, at the end, about 13 minutes or so from now, a bulleted list of exactly what we need in our note. Thank you for joining. Dr. Jeff Lehrman. I'm a podiatrist and a certified professional coder and a certified professional medical auditor, and I will be leading us through this discussion of documentation requirements associated with providing surgical dressings. Just in case you are new to this surgical dressing program, and just in case you're listening and saying, what's he talking about when he's mentioned surgical dressings, we are referring to the products available in this picture, things like collagen, collagen powder, collagen pads, foam dressings, gauze dressings, hydrogel, compression garments. These are all examples of surgical dressings, and all examples of surgical dressings available to us as providers from Amerix. These are products that we can purchase, keep in our offices, and then when we have a patient with a wound for which one or more of these dressings is appropriate, we can dispense the dressing to the patient, give them the collagen that they need. They walk out the door with the product that they need, and then we get to submit the coding for the product. There are many advantages to this program. Most importantly is the benefit to the patient. Most importantly is the fact that peer-reviewed literature tells us there are improved outcomes in the treatment of chronic wounds when participating in this program. We're not sending somebody to a pharmacy where we know oftentimes pharmacy doesn't have what we wanted, it gets substituted, there's a crazy copay and the patient gets nothing, or the patient never goes to the pharmacy. Patients love this. They love walking out the door with a bag full of the stuff that they need and not being told to go to the pharmacy where there are all kinds of potential pitfalls. So most importantly, the benefits of this program are related to outcomes and better quality of care. It doesn't hurt to mention that there also is reimbursement associated with our participation in this program. I mentioned we buy the products, then we get to submit the coding for the products when we dispense them. And the reimbursements are higher, and in many cases, way higher than the costs. So not as important, but it doesn't hurt to mention there can be significant profits associated with participating in this program. Amerix also has the option to not buy them and dispense, but rather have the products delivered directly from Amerix to our patients' homes. And just like every other service we provide, there are rules, documentation requirements, compliance considerations. And fortunately, with this service, we know exactly what the rules are. No ambiguity, no guessing. Sometimes when we talk coding and documentation and rules, it may be in some cases fair to say, about a certain service. How am I supposed to know? I can't keep up. This stuff changes all the time. That is not the case with the surgical dressing program because CMS has one surgical dressing coverage policy that applies to the entire country. It has not changed with any significance recently, and the policy is very clear. No ambiguity, no guessing. We know exactly what the rules are. We know exactly when these things are covered, exactly when we can dispense, and exactly what needs to be in our note. These policies are free and online and publicly available. And Amerix, when you purchase surgical dressings through Amerix, partners with its providers in many different ways, one of which is by supplying them with this really easy to follow coding guide, which takes the content of those policies and really distills it down into exactly what we need to know. Because while I stand behind my statement that these are very clear and tell us exactly what the rules are, they're not necessarily user friendly. They're not what I would call easy reading. This is. And this document from Amerix takes all of this information, puts it into a format that makes it very easy to process and tells us exactly what we need for collagen, exactly what we need for foam, and so on. Amerix also provides its customers with these documentation guides, which I think are invaluable. And we're about to go through a bunch of documentation requirements, and we're about to explain what needs to be in the note. And I still think that's valuable information, of course. However, if you just use these and fill in the blanks, you know you have a complete, compliant, thorough note. These documentation guides are skeletons, which prompt us to fill in the blanks for a complete and thorough debridement note and surgical dressing dispensing note. Debridement documentation requirements from Medicare differ based on geography. There are different Part B Medicare contractors that have different rules. So the list of stuff that needs to be in the debridement note for a Florida Medicare provider, looking at these maps here, is different than the list of stuff that needs to be in the note for an Iowa Medicare provider, for example. So that's why there's different guides for different parts of the country. And I'll say again, this is one of the benefits in partnering with Amerix, in aligning with Amerix. They're not just selling us stuff. They're actually holding our hands through this process, providing guidance like the webinar you're watching right now, and providing us with these types of tools to hit on some of the more important documentation points. And frankly, some of the more common documentation errors that I see. We start with the requirement to document the medical necessity of the surgical dressing. Medical necessity is an umbrella requirement over all services we provide. If you are a surgeon watching this, you know that when you go into the PACU after a procedure and dictate your op note for that elective, reconstructive, whatever, what's the very first thing we dictate? Indication for procedure. Patient has this problem. It's been here for this long. We tried A, B, and C, and none of them worked. Therefore, we're here today to perform blank procedure. That's documenting the indication, documenting the medical necessity. So you can apply this umbrella to every service we provide. If we are submitting claims to third-party payers, which if you're watching this, you probably are, a requirement that is associated with every single service we provide is to document the medical necessity of that service. And that applies also, of course, to surgical dressings. Why is this collagen medically necessary? Amerix has an entire 30-minute webinar devoted just to this requirement. We did that because it's one of the more common errors. It's one of the more common things I see left out of our colleagues' notes. And unfortunately, it's one of the more common reasons for audit failure. They list failure to document medical necessity. So if you're listening to this and saying, what does he mean? What might an example of that look like? Please engage with this webinar that is free and available online on the Americs website. It is an entire 30 minutes just about documenting the medical necessity, which I suggest you will be able to use some of that information in other services that you provide. We also must document exudate quantity. We must document the quantity of exudate using one of the 5 words in this bulleted list, not just exudate type, but also exudate quantity. We also must be using these for an ulcer that was debrided, and we have to document that the ulcer was debrided. What's on the next 2 slides is a list of bullet points that are required in our documentation. When dispensing surgical dressings, all of this stuff needs to be documented. Here's the good news. All of these on this list are also documentation requirements for ulcer debridement. So if you are appropriately and thoroughly documenting your ulcer debridement, you are already meeting all of these requirements that apply to surgical dressings. And I'm going to go back to this and point out that this is the kind of stuff, what was on the last slide, that is in these documentation guides. These prompt us to fill in those blanks. So for example, let's look at the last bulleted item in the left-hand column. We need to document what instrument was used for debridement. So in that documentation guide from Americs is, I don't know if it's exactly this, but you get the idea. It says, instrument used for debridement, scalpel, scissors, curette, or other. And we circle, or if you're using EHR, check the box that represents the instrument that was used. If you are listening to this and saying, I've been doing this for 20 years, I've never used anything other than a scalpel. Well, this is a situation where we can use the EHR to our benefit and create a documentation template. That includes the fact that you use the scalpel if that's what you're using every time. Cloning is not allowed. That's really, really, really bad. But using a documentation template that contains items that are common to multiple patients, we are absolutely allowed to copy and paste things if those things are pertinent for the different patients that they are used for. And of course, the note needs to be customized and appropriate specifically for the patient that was treated, and that's exactly what that documentation guide does. It prompts us to fill in those blanks. All of the requirements on this slide must be documented in the progress note. We must, in the progress note, document what dressing was dispensed. So I dispensed collagen powder. The size or quantity of the dressing dispensed, how many grams, how many ounces, a 2-inch by 2-inch pad, the quantity dispensed. I dispensed 30 2-inch by 2-inch collagen pads. The number of wounds being treated must be documented in our progress note. These are being used to treat 1 ulcer. How frequently the patient is changing their dressing, and we must document the anticipated time that the patient will need the dressing. So we need the following sentence. It doesn't have to be exactly this, but this is a really good example. I anticipate that the patient will need these surgical dressings for blank days. It doesn't say we have to nail our anticipation. It doesn't say we have to accurately predict. We just have to document how long we think we're going to need it. If we have to change it later, that's allowed. If the documentation supports why we are changing it. I stressed that all of these must be in the progress note because many of these also are documented in the proof of delivery and or the standard written order. Yes, They must be in both. Yes, that is duplicative. Yes, that is burdensome. Yes, that is putting paperwork over patients. I agree with all of those things. If you in the audience are thinking that right now, it must be in the progress note. I see too many colleagues run into trouble with these, and they say, well, yeah, but it was in the proof of delivery. It's not the requirement. It has to be there, and it also has to be in the progress note. The final requirement that we want to hit on here is that we must document whether the dressing or dressings, plural, being dispensed are being used as a primary dressing or a secondary dressing. A primary dressing is one that goes directly on the wound bed. A secondary dressing is one that goes over the primary dressing to secure it, to hold it in place. And we must document whether what we're dispensing is being used as a primary or a secondary. So for example, this collagen powder is being used as a primary dressing. This bordered gauze is being used as a secondary dressing. I see colleagues run into trouble with this one when dispensing Americ's kits. If we are dispensing a kit with two different dressings, this rule applies to both. So if the kit has collagen powder and bordered gauze, we have to fulfill this requirement for both. For some reason, I see people fulfill this requirement for the powder and then not for the gauze. No good. If we're submitting the coding for both, we have to meet the requirements for both. So if it's a kit that is collagen powder and bordered gauze, we need the following two sentences. This collagen powder is being used as a primary dressing. This bordered gauze is being used as a secondary dressing. And just like we said for medical necessity, because this topic has a little more meat to it than what we're diving into here, there is a full 30-minute webinar devoted only to this topic of primary and secondary dressings and how to appropriately document primary and secondary dressings. And again, one last time, those sentences are the types of things that are in these documentation guides. The concept of this is being used as a blank dressing, fill in the blank with primary or secondary. That's the type of sentence that is in here, prompting us to fill in the blank. We've left a couple minutes here. We're going to finish at 30 minutes after the hour as promised, but we wanted to leave time for Q&A. If you have questions for those that are attending live, please, if you look at the GoToWebinar control panel, you see the word questions. There's a little triangle there. If you click the triangle, you get a drop-down menu. Anything you got. We left time for a reason. We left time because we want your questions, and we hope that those are attending will take advantage of that opportunity and type those questions in. If you are not attending live, if you're watching this recording and you have questions, please use the email on this slide, which is marketing@amerixhc.com. If you're watching this, chances are excellent you have an interest in this type of coding and compliance and documentation content, and there are tons of these webinars, dozens and dozens of these webinars on coding, diagnosis codes, treatment codes, ulcer debridement, documentation. There's tons of content banked on the Amerix website, which is amerixhc.com. HC stands for healthcare. I think that makes the website easy to remember. And looking at the landing page here, toward the viewer's right of those tabs, you see the words Education Center. That's where these webinars are, in addition to blogs and lots of other content. And we will now get to the questions that have been answered or asked, sorry. The first one is, can you explain more about primary and secondary dressings? Yes, and actually, I'm glad that was put in there because I wanted to do a little more time on that. First, we're not going to do the whole full blown out thing because we don't have time for that. A reminder, this webinar explains everything you need to know about primary versus secondary. But to review, a primary dressing is one that comes in direct contact with the wound bed. A secondary dressing is one that is used to secure the primary dressing. I suggest the great majority of the time, we do not want to dispense only a primary dressing. For example, collagen powder, we can't just put that on the wound bed and leave it. We need something over it. So if we give the patient the collagen powder, that's great. That's a good start. And then we say, well, you got to cover that up with a Band-Aid. Not as simple as it sounds, right? Anybody that's been doing this for a while knows that doesn't work. What happens? Well, typically the patient says, do you have those for me? Can you give me some of yours that are in the drawer? Or I don't have Band-Aids, or I can't afford Band-Aids, or I don't have transportation to the store to get Band-Aids. This is filled with potential problems, potential pitfalls, telling them to cover it up themselves. The secondary dressing is probably covered, and we can dispense the primary and the secondary. So we can give them, if we have the products in-house from Amerix, we can give them the collagen powder and the bordered gauze, the gauze with the sticky adhesive to put on top of it. Now we're giving them everything we need. That's better care. That is a more satisfied patient. We have a better chance for a better outcome, a better chance to avoid compliance issues. And I saved this for last for a reason. We get to submit both codes. So that's more profit for us on the supplier side. The next question that was asked here is to clarify dressing size. So I think what you're getting at here is maybe what do we mean by size? So let's just look at this slide, for example. In the bottom right, we see bordered foam. So Amerix, one of the products we can dispense is foam. The foam is typically for moderate to heavy exudative wounds, so more drainage coming out of the wound. That's why we would want a foam. And Amerix has bordered foam and non-bordered foam. So maybe we want the foam with the sticky adhesive, or for some reason, maybe you prefer it without, and they're going to put a piece of paper tape on top. Well, these foams come in different sizes. So we are supposed to dispense the size that is most appropriate for the wound. So for example, if we have a wound that's 1.5 by 1.5, is it appropriate to dispense a 4 by 4 piece of foam? No, that's excessive, because looking at the size options in the bottom right here, there's a 2 by 2 foam, and that's the one that would be most appropriate for our ulcer, which is 1.5 by 1.5. So we're choosing 2 by 2, and when we go back to this requirement to document dressing size, we're going to say, I'm making this up, but if this is the case, I dispensed 30 pieces of bordered foam, each 2 by 2 in size, right? Documenting the size of the foam. And then following along here, we also need, the patient was told that once a day they should, right? And then you fill in the blank with what your instructions were. And I anticipate the patient will need this for 45 days. I'm making that up, whichever you think is most appropriate for your patient. Those are all the questions that were asked. We're going to welcome back in Josh from Amerix in a moment with some important concluding information. Before we do that, thank you for your attention, and we hope that this information was useful in helping you to fulfill documentation requirements and to never worry about anybody looking over your shoulder. Because if you know the rules and you're following the rules, they can come read our notes all they want. Thanks for your attention, and Josh will wrap up with some important Amerix information.
Hello, everyone. I would first like to thank Dr. Jeffrey Lehrman for an entertaining and informative presentation. If you would like to learn more about how Amerix can help with patient efficacy, access to guides, or partnering with Amerix, please contact us at sales@amerixhc.com or call our 1-800 number, and we will be happy to work with you and develop a strong partnership. Doctor, thanks again for the presentation. Everyone have a great day.